Now if she comes back, another way of doing that, foot off, she's coming back into your arms, you're still rolling into that left sit bone in, but instead of just lifting that leg, you're rotating that leg. So see how the leg is learning how to lift through the hip versus through the thigh muscle. It's a little bit harder to show on Frank, but most people think a lift, let me see if I can do it on me. This is the one thing that needs to change with her. Not it, and this is quote that the CP, but the way she's worked up her balance and counterbalance. And I'm reading a really interesting book on movement. However, this is where she blows it. But this is what people think of. People think of as gravity, right? And I'm lifting my load off the table. And I get it, there'll be some kind of load, but that's completely a lift. I'm using my thigh muscles to quote lift the load. That's not what babies should do, and that's not what humans should do. I get it that this is an exercise, but this is where exercise is completely different than a movement. What I'm looking for is now that same pelvic to counter and lift, quote, the load that way. And that's where you're getting that opposing gravity. And see when I do it, I wish I had like a dot here, but you see how much my thigh rotates to come back. So I'm not doing this. See how the dot wouldn't move. It would stay in a horizontal or a vertical line, going up and down. That's a lift. I'm looking for a movement, and that's a rotation. But when I do that, then I can go here, or I can go all the way around and come here. Do you see how it's the same? I keep my knee up, but I'm moving around myself. If I just go and do a, quote, lift, now I'm stuck. So now in a lift, to keep this knee here, you know what I mean? Look at how spastic I get just to keep that knee in that same position as a lift. And now I'm falling. I can't even hold it. Whereas here, see, I'm keeping my knee up, but see how I rotate around that same due to rotation.